LBC.
It's 10:47. You are listening to James O'Brien on LBC. So the Labour MP Andrew Gwynn did raise this in the House of Commons last March, and I think that the absence of an answer to this question has just become more and more dangerous and puzzling. And of course, he's now a member of government. So next time you bump into him, ask him if he's still rattling this particular cage.
As somebody who has fought really hard over the last 4 years to overcome the difficulties presented by long COVID, I'm sure the Secretary of State will appreciate that a significant number of people not in work because of health conditions will be down to some form of post-viral fatigue linked to long COVID. So what assessment has he made of long COVID on the workforce, and what's he doing to help people get back to work who have it?
I think the answer was not a lot, but I'm open to correction on that. That was the only clip I could find. Debbie speaks for many people contributing to the programme, and she writes, "My son has it. He had to leave university before finishing his degree. He's at home. I'm caring for him, so I can't work either. And whilst the GP acknowledges it is long COVID, he's not referring him. He's refusing to refer him to the long COVID clinic because, in his words, they don't offer anything useful. So if there's nothing in place to improve the situation, why would anybody draw attention to it from the political sphere? Well, children, because that's how you start the process of creating something that will be in place to improve the situation. I would have thought to fix a problem, you've got to acknowledge it, which is probably a timely moment to say the word Brexit for the first time on the show today. Gareth is in Cwmbran. Gareth, what would you like to say?
Hi there, James. So my name's Gareth. I'm a trustee for the charity Long COVID Support.
Okay.
So this is something that's very sort of upfront in our minds at the moment.
Clearly.
So this I have to say there's probably quite a lot of facets to this. I think.
Shall I ask you questions rather than expecting you to sort of regurgitate all of the stuff you know, because you probably know more about it than I do?
Yeah, go for it.
So, what is it possible to generalise about the response of the medical establishment to people presenting with long COVID? Is there a sort of broad picture of what reception they are likely to receive when they go to the doctor?
I mean, it's very variable because. Depending on where you are in the country, you mentioned the long COVID clinics.
Yes.
I'm aware there are some in England. At the last count, there were apparently 90 long COVID clinics and 13 hubs for children and young people. However, we are hearing reports that some of those are now closing down due to lack of funding. But elsewhere in the country, in Scotland, Northern Ireland and Wales, there are no sort of dedicated clinics.
Right.
And, you know, depending on who you speak to in the medical community, you'll find that some are quite clued up on long COVID, but then there are others who maybe sort of don't recognise it or are quite dismissive about it.
How abandoned do you and your fellow supporters and members of the charity feel? And that's an emotive word, so feel free to poo-poo it or dismiss it, but that's the word I'm starting with.
I think it's a fair comment. That we feel abandoned. We feel, we are involved in the current COVID inquiry at the moment, and it's been very often talked about that we feel like the forgotten victims of the pandemic because the focus was on the people hospitalised and who sadly died, and that's we appreciate that. But then there's the long term consequences of the pandemic, which unfortunately is still ongoing.
How has it affected you? Is it you or is it a loved one that you're advocating for?
I have long COVID, myself, yeah.
So I know I put probably too much effort at the top of the show into telling people not to ring in with their symptoms, but we should hear from at least one sufferer of how it has affected you. What's it done to you and your life and your family, Gareth?
It's had a profound impact on my life, quite frankly, yeah. So in terms of my physical health, I was fit and active before. I was doing triathlons. I can't do that anymore. I'm doing some form of exercise, but nowhere near to the extent I used to. My career has suffered. I was in a good job, a professional, qualified, and I'm finding I'm having to sort of adjust to what I'm able to do now.
And why do you think the conversation is still so quiet?
As I mentioned, I think some of your previous callers have touched on a few points. I think the issue at the moment that we're finding is that because there's no diagnostic test for long COVID, we don't know how many people have long COVID in this country. We've got the only thing we can hang our hat on at the moment are the ONS updates.
Yes.
At the last count in March this year, there were 2 million in England and Scotland with long COVID. These are self-reported cases. So these are people that know that they have long COVID. And as one of your previous callers mentioned, there are health consequences around, heart attacks and strokes that we can't say for sure, but we've got a good inclination as to what's causing those, and that's COVID and long COVID.
And then the mystery gets bigger, doesn't it? Of why? I mean, because if you are looking at it from an exclusively economic point of view, this is disastrous on every single level, and that's ignoring the psychological and social damage that it's doing to you and families like yours. Is there anything else you want? Because I said I'd try and tease out the salient points rather than expecting you to sort of cough up an entire essay on the subject. But is there anything I haven't touched on that you wanted to bring to a wider audience, Gareth?
Yeah, I think you mentioned it briefly about why the government's maybe resistant to addressing this is that it requires investment in research and clinical trials, and there's this whole thing around COVID being an occupational disease, in which case employers would have to provide safeguards, and which requires an initial investment. But unless they do that, what we're finding is that the burden of the sickness levels in this country are going to get to a level where it just becomes unsustainable. The benefits,
and that will cost more. It will cost more in the long run than it does in the short run. Yesterday Wednesday was a budget that, for good or for ill, prioritised short-term expenditure in the pursuit of long-term improvement and saving, but not on this front. Maybe it was a front too far. Gareth, take care. A lot of love for you coming into the studio, and just as Debbie spoke for many when she described her son, so Tim speaks for many of you when he describes his mother. James, can I just say thank you? I'm desperate for long COVID to be in the spotlight. My mum's been suffering for years now, still has no explanation or answers. It's brought on severe OCD, I'm hearing that a lot as well, and her life is as good as over. It's like people with the condition just don't matter. So Tim in York says thank you, not just to me, but also to people like Gareth, of course, who by working with the charity Long COVID Support, at least try to draw the spotlight to this situation. And it is still baffling, right? More baffling now than it was at the beginning of the hour, that the conversation... We have had it once or twice before, from various perspectives, but the sense of momentum is not there. And I think that we've spoken to Lara in Fareham about some of the attendant issues as well, most recently, when the inquiry first kicked off. Which of the questions that I've asked today are you keenest to answer, Lara?
Oh, there really is so much that impacts our organisation. So I represent clinically vulnerable families, which is a group which speaks on behalf of all of those who remain at higher risk from COVID infections. Those people who continue to qualify for COVID vaccines, some of whom also will qualify for antiviral treatments if they can get hold of them. And to be honest, that's another whole issue. I think when you talked about that surge in post-COVID claims for benefits and things, we found, and I urge you to look at this data actually, James, since Freedom Day and since Living with COVID were announced, there was a massive increase at those points in time, particularly, and I would say, and I would agree with your GP, from people who remain vulnerable to COVID. And it often goes down as anxiety and depression, as the GP said. But you said COPD, diabetes, all of those other conditions that put them in those high-risk groups from the worst outcomes from COVID have not been protected sufficiently. Their needs have not been considered. They've been forced back to in-person work. Workplaces have not been kind of made safe. And, where Rosamond was talking about her amazing work to kind of get air filters into schools, we would very much support that. And we've been fighting for this, for a long time now. We very much do believe that air filters do need to be in place in all public buildings, as was actually said by Chris Whitty in the COVID inquiries not long ago.
I wasn't 100% sure of that, so I didn't say it out loud, but you're absolutely right.
He has recommended this.
Yeah. I knew there was something.
And this is a huge problem, and it's a massive gap, and it's causing problems for people accessing healthcare safely. So, also our people are high users of healthcare, and they cannot get into those buildings without risking contracting this virus. What
do you say in response to the question of why the conversation is not louder? And in a sense...
Okay. I have a very kind of sort of clear view on this.
Good.
There's a post-pandemic trauma that has been experienced by everyone in the country. And we see it. We see it, and as our members go around and they wear masks because they have to continue to protect themselves because nobody is protecting them.
Yes.
And so they have to take personal responsibility, as the government told us. But personal responsibility leaves those with the greatest burden of risk to carry the most responsibility. And I think that's wholly unfair. And we're not living, we're a massively marginalised group. We're not getting the support. We're not considered, we're not even an equality group.
No.
Nobody considers us in equality impact assessments. We are a different group to disabled people. You can be disabled and not clinically vulnerable. You can be clinically vulnerable and not disabled. We're not protected under the law in that way. And in fact, we're a bigger group than disability. But nobody's considering our new needs since this new virus has emerged.
And that is partly due to the trauma you described, the sort of collective social trauma, and partly probably due to slightly more prosaic reasons or pragmatic reasons, like the size of the elephant in the room and the cost of dealing with it.
Exactly. And, our members, I've told them because nobody is collecting our data.
Right.
82% have lost work or retired early since the pandemic. Right. And that's insane. Nobody's talking about this.
82%?
Yes.
Of your membership?
Yes. Lost work. Not necessarily. Some of them may have returned back to work, but, at some point they have lost earnings
and a huge,
or lost jobs.
And that will be a large part, or rather a large part of that will be people who are also signing on for benefits to get them through those periods of inactivity.
Exactly. And actually some of that lost work will have been from people who live in households with clinically vulnerable people as well. So we're clinically vulnerable families because it affects the entire household. It's not just that one person who's at risk. The household has to manage their risks.
Indeed. Laura, I mean, crikey, the burdens you bear, and Gareth and almost everybody else who's contributed to this programme, and it's one of those really weird conversations from my point of view where that you sort of sometimes think that I don't make it worse for people like Laura and Gareth and everyone else who's contributed, but for those of us who just have the luxury of wondering and worrying, the more you talk about it, the bigger the wonder and the worry becomes. So imagine what it's like if your whole life is in the balance as a consequence of it, of this continuing silence. Answers on a postcard, please, for what the hell we can do about it. I don't even know which part. I suppose Wes Streeting in the first instance would be somebody who might be worth buttonholing. I do see him occasionally in the lobby. It's 11 o'clock.